Danny, the bird.
Greetings of love, peace, health, happiness, and prosperity. Hello, everyone. This is Dr. Akila, and welcome to another live stream that we are having here. Let me set everything up. There we go. There we go. Let me see. Where's the trend? Oh, wow. We got ladies in here already. What's up? Greetings, your pa. Lovey, Gigi, kisses, Ashe. Hello. How are you all doing? You all came here just in time, huh? We're going to go ahead and get started right now. Hello, Miss Desiree. How are you all doing? Wow, I never had this. As you all know, I had let this channel die, so I'm trying to revive it. We're not trying. I think I'm doing a good job reviving it. So here we are. Now, as you all know, we're going to, I'm going to do a little education here about fibroids. Some of you probably know this information, some of you don't, but if you have any questions, just go ahead and ask in the chat and I'll get right to it. So we're just going to talk about the signs, symptoms, and treatment. Not too much about the treatment because I think I covered it already, but I'm going to also go over some other types of things that you can do for the fibroid tumors that you're experiencing. So there's that. Now, as you all know, fibroids are non-cancerous, they're benign tumors that are growing within, outside, around the uterus, and they cause a lot of problems. There's lots of symptoms. I guess we want to talk about the symptoms first. Actually, no. Let's go over the different types of fibroids, and then I will go over other symptoms that I haven't talked about already. So let us go ahead and start. Hold on a second. I got my presentation here for you all. Let's go ahead and start with the intracavitary fibroid. Now, the intracavitary fibroid is a fibroid that grows within the cavity of the uterus. It has a stalk. This is the type of fibroid that prevents pregnancies. If you do get pregnant, which is rare, but it does happen on a rare occasion, but you do not carry it to full term. And the reason why is because, well, this fibroid here is competing for the space of the cavity of the uterus. So when you have a fertilized egg, whether it's from this fallopian tube or this fallopian tube, traveling to embed in the endometrium, which is the lining of the uterus, when it's trying to align there, well, it can basically embed itself in there. However, once it starts to grow, it will compete with the intracavitary fibroid. These are the fibroids that cause very, very, very hard bleeding, heavy bleeding. Heavy bleeding result from this. Okay, so there's a lot of fibroids. There's different type of fibroids that don't cause any bleeding at all, and there's some that cause nothing but heavy bleeding. We're talking about extreme heavy bleeding and extreme clotting. But most of all, some women have miscarriage when they get pregnant with an intracavitary fibroid there, or they just can't get pregnant at all. So this is what I want you all to understand when you think about this type of fibroid. This is the reason why, and I know a lot of people don't have health insurance. There are some programs where you can have get one ultrasound done, and usually, like, a lot of doctors are lazy and a lot of women are passive. They don't know how to be stern with their doctors, because you have to make sure that these doctors do their job by basically telling you the location of the fibroid, the size of the fibroid. The size is normally done in centimeters, rare cases millimeters, and the type of fibroid you have. You have a good doctor, they'll let you know that. You have a bad doctor, they're going to be like, oh, you got fibroids, and let's go ahead and get a hysterectomy. So there's usually something like that. So this is the main kind of intracavitary fibroid that cause a lot of problems, prevent the fibroid prevent you from having a pregnancy. When I have helped women shrink fibroids, I really don't like the intracavitary. For the main reason is, when I put them on a program to shrink this, 8 times out of 10, this doesn't happen all the time, but it does happen often. Well, when the stalk is drying up, and therefore the lifeline, which is the lifeline to that fibroid. And this is the opposite of a pedunculated fibroid, which we're going to talk about later. The two types of fibroids that have stalks are pedunculated and intracavitary fibroid. When that stalk is dried up, which is not my main interest, I'm trying my best. My aim is to have it shrink to the point where it just dissolves on its own, and there is no passing through the cervix, because if and when it does do that, it's painful. You're literally giving it's like you're having a miscarriage. And I've had some women who have been underneath my program, and they had that intracavitary fibroid. Everything's going well. The bleeding has subsided. The clots have stopped, and all of a sudden they just get this extreme bad cramp, like pain, like they say, it's like somebody sticking needles in them, and they don't start, they see bleeding, and they automatically go to the ER, as you should, and automatically their doctors assuming that she's pregnant, or she's going through a miscarriage. So they do what they do with the medical doctors. They dilate the cervix, and she passes it through, and it's not a fetus, it's a dead fibroid. So that tends to happen also. And I mean, the good news is that it's gone, it's not there anymore, you know what I'm saying? But the bad news is that here you have that painful experience that you have, you know what I'm saying? So that's my aim, is every time I have someone has an intracavitary fibroid, I do my best to avoid that happen, but it can happen. I always let the women know ahead of time. The second one that I want to talk about is a submucosal fibroid. Submucosal fibroid also causes clots, and it also causes heavy bleeding, but not as much as an intracavitary fibroid. Intracavitary fibroid, when you hear women talking about something, they had to go through so many menstrual cycles, days, they go through so many pads that they all have to take off from work, it's usually this. But the submucosal one also causes some heavy bleeding and clots. Let me explain why. So we have a submucosal that's inside the walls of the uterus, but it protrudes into the cavity. The body is mistaking this as something else I forgot to tell you. Oh, okay, hold on. Sorry, gotta go back to intracavitary. Extreme cramps, very bad cramps. Let me tell you why. Okay, I forgot to include this. So when women have intracavitary fibroids, they go through the heavy bleeding, they go through a lot of blood clots. Sometimes the blood clots are thick, and they go to the most extreme, like horrendous menstrual cycle. The reason why is because, menstrual pain, like cramps. And the reason why is because the uterus knows that this is something here that's not alive, it's not taking, it's not growing. Because when you get pregnant, for example, or shall I say, let's just talk about how the uterus works in general. So, when you release an egg, the endometrium walls begin to thicken. This is what you call your menstrual cycle, your menses. So that and your menstrual cycle, your menses are filled with nutrients. It has a lot of nutrients in it so that it can form into a placenta, therefore giving it to the fetus so it can grow into a baby. When the fibroid doesn't react as a fetus is supposed to react, the body thinks it's a dud. The body thinks, okay, this fetus did not grow properly. It's not working. So let's go ahead and get rid of it. And therefore you have the contractions within the uterus. This is causing that to happen and this is where you say you feel like you're going through a miscarriage when you have these things. Because that's what the uterus is wanting to do. Something similar also happens with the submucosal fibroid. When a submucosal fibroid pierces through the cavity of the body, it basically is letting the body know, hey, here's an implantation. Here's an implantation. And the uterus doesn't know. The uterus, because fibroids was something that was not always in our ancestors, you know what I'm saying? So and also the beginning of time. So the uterus is assuming like, hey, they're assuming that this is a fetus, and therefore, but it's not behaving like a fetus. And sometimes, when their actual fetus is not taking to the endometrium, it just doesn't grow, and therefore you have a miscarriage. So the body expels it. So that's what it's trying to do every month. And that's the reason why women who have intracavitary fibroids or submucosal fibroids have really, 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 really bad cramps, really bad, painful cramps, to the point where they have to be on their back with a hot water bottle or a heating pad or take some over-the-counter medication. You know what I'm saying? Because this is the body reacting to it. So when you have the lining of the uterus begin to thicken, and it thicken, because it's like, hey, how come this fetus, this embryo is not, actually it's more like an embryo in the beginning and then it goes into a fetus. How come this not collecting into, how come it's not forming into the placenta? And that's where you get a lot of your clots from, because it's working to collect around the fibroid, assuming that it's fetus, assuming that it's a baby, but it's not. And therefore, that's when it goes, okay, this is not taken, so let's go ahead and shed that out. You shed that out. That's where the clots come from. That's where a lot of your menstrual cycle comes from all the collection of the menses within the uterus here. Okay, so the cavity of the uterus, the cavity of the uterus here. And so these two will prevent a successful pregnancy. You can get pregnant under a submucosal fibroid versus intracavitary fibroids. If the implantation happens where it's embedded itself into the walls of the cavity of the uterus, it ain't gonna last long. So but here, depending on the location of the submucosal fibroid, if the submucosal fibroid is here and you got an implantation here, just ignore this intramural. Pretend that intramural is not there and you have an implantation here, well then it's a successful pregnancy and it will grow. However, so will the submucosal fibroid. So then both the fetus, the baby, as well as the submucosal fibroid will begin to grow together and it will fight for room. Sometimes you have a premature birth, so you have the baby early, or you have a miscarriage. But it just depends on the size of the mucosal fibroid and the location whether you'll have a successful pregnancy. Normally, in these cases, they'll do a C-section if it's a small one and it's grown if the baby is twice the size or 3 times the size as the fibroid, then they'll do the C-section. I know now they just do C-sections for anything now because it's a money grab, but I digress. This is where they used to, when I was doing this a lot, they used to do C-sections under this here. All right, so since we have there we have the first one inside the cavity of the uterus. It's only inside the cavity of the uterus. Then the submucosal fibroid is protruding into the cavity of the uterus, but it starts here in the walls close to the endometrium. And now we have the intramural. This is a very, very, very popular fibroid a lot of women have. I would say out of all the fibroids I have dealt with, all the women I have dealt with, the fibroid that's very, very common is the intramural fibroid. Intramural fibroid is always in the fiber walls of the uterus. So right this is the fundus. You can also have it here in this area here. Sometimes they're close to the cervix, but not all the time. And usually, which I only had like probably a handful of women who had cervical fibroids, but and those are just basically intramural fibroids that have moved close to the cervix here. But your intramural fibroids are always going to be inside. A lot of women can have this and not know they have fibroids. So this is when women have fibroids and they go, I didn't know I had. You can have it a pretty good size and still not know, because these type of fibroids don't cause heavy bleeding. They don't cause blood clots, provided if they're not. No, let me take that back. If they're big, they're going to distort the uterus, and the clots are going to come. Okay, so that will happen. But these are the kind of fibroids that don't really cause any type of menstrual for you to have any menstrual cramps. Hold on, let me drink my water. So you have any type of menstrual cramps. So usually when I get ultrasounds from the young ladies, I want to know where is this intramural fibroid located. So I want to know if it's on the top, if it's on the side, in front, back. They normally tell you that. Also, I want to make sure it's not a cervical fibroid, which is what an intramural fibroid would be if it's close to the cervix. Women will definitely know if they have a cervical fibroid, because sex would be very painful. Like they don't even want to deal with it anymore. It's just no matter what position you're in, sex is very painful because that fibroid is pushing there in the cervical canal. Okay. Then we have the subserosal fibroid. Okay. Now we're getting into the fibroids that distort the body. Intramural fibroids can also distort the body only if they're really large. But the two types of fibroids, we're going to go over one of them that always distort the body. What do I mean by distorting? I mean that these are the fibroids that make you look like you have a little, what they call a fupa, a little pouch there. It makes you look pregnant. This is where it's like it can grow so big. Subserosal fibroids are fibroids. They're the opposite of submucosal, okay? They're the opposite of this, where you have the submucosal fibroids that are inside the wall of the uterus and it protrudes into the cavity. Well, the subserosal is the opposite. The subserosal is in the fiber of the uterus, but they protrude outward. So you have the subserosal one where it's coming out, and these things can get really, really, really big, okay? And the bigger they are, it'll cause the fibroid to either lean forward or lean back. If your and intramural can do that too. Intramural will also depends on where that's located. If you have several of them and a subserosal one, these are the fibroids that can cause your uterus to lean back. If it leans back, it's going to cause you to have constipation. If it leans forward, it's going to cause you to always have to go and urinate. You can never hold any water because you constantly got to go pee, okay? So subserosal ones are the ones that can really get really, really, really big. And then we have the one I hate the most is the pedunculated. And I mentioned that last time. Why I hate the pedunculated fibroid is because it takes the longest to shrink. It takes the longest to shrink because they only have one lifeline, and that's this stalk right here, as you can see right here. Now, this is pretty short stalk. I have seen some stalks that are longer than the uterus itself. And pedunculated fibroids also move. You can feel them. And these are the things that when you're, like, say for instance, look at this thing right here. So we have the subserosal, we have the intramural, submucosal, right? So let's say for instance, I put you on a fibroid shrinking plan based upon your fibroid. Now, just for the record, I've never had anybody, and I'm not saying this doesn't happen, but I never had anybody that had a submucosal fibroid and a pedunculated fibroid. I never had that. I kind of understand why that's not the case, but no, I've never really had that. But they're usually, if you have a submucosal fibroid, you're going to definitely can have an intracavitary fibroid. Excuse me, intramural fibroid, not intracavitary. Intramural fibroid, submucosal fibroid, right? So let's say, for instance, the person has a intramural fibroid and a subserosal fibroid, which I have also seen in a pedunculated. So the reason why I don't like these is because they take the longest to shrink. They also can grow very, very big. So if I put someone on a fibroid shrinking program, the body is going to go and send a lot of the herbs through the lifeline of the intramural, and whatever left is the subserosal. The pedunculated is the one that gets little to nothing, okay? So I want you to understand, I'm sorry, is it the same as a pedunculated? Okay, answered. Subserosal and pedunculated. I see. Okay. All right. I'm so sorry. I'm looking. I need to be looking at the chat. Let me position the chat better. Okay, I put you all to the side so I can make sure I see you whenever you're asking questions. Sorry about that, Ashay. So this is what I want you to understand. So the pedunculated is the one that's like get the last of the herbs if there's any left. But the one, this is how I work my clients, is that I want to see which one of these is getting the most lifeline. And this goes from keeping up with you through the follow-up. And the one to get the most lifeline, and it doesn't necessarily mean is anything dealing with these intramural or subserosal or submucosal. Any of these can get a lot of lifeline except for the pedunculated, because the pedunculated has one stalk. I've never, ever, ever, ever have seen a pedunculated fibroid get several stalks. Okay, never, ever, ever. All right. So this is what I want y'all to understand. It's like, these take a little longer to shrink. And I've had some clients come in and with huge pedunculated fibroid, to the point where they look like they're 8 months pregnant. And I just tell the young lady, I said, listen, I'm not even going to like sugarcoat this. You could either stick to the most strictest program I have ever given you for 5 years and get that thing to shrink half the size, or you could just go ahead and get it removed. Now, I know that sounds strange from me saying, yeah, go get it removed, go get a myomectomy. Yeah, because the pedunculated fibroid with her size, when it's distort the body like that, when to the point where you look like you're 8 months pregnant, I could tell that was making her feel depressed, because people are walking up to her, treating her like she's pregnant, congratulating her, saying, oh, when is the baby due? It's a very humiliating process. And she looked huge. And when I saw the ultrasound as well as the CAT scan of the fibroid, I was just amazed. But she had that thing growing in her for over 13 years. So, I was like, I commend you, but how about you get that? Listen, you got other fibroids there. It's up to you what you want to do with them. Now, I can handle the intramural one. I can handle the submucosal one. But that pedunculated, I'm just being honest with you. So if you want to take, I'm going to give you the program for the others, but you're going to have to make the decision about the pedunculated, because I understand it's a very stressful way of living and humiliating way of living, because it's so big that it's really making you look pregnant. You know what I'm saying? It's because if she was bigger, she was a small thing and with that huge stomach. So that's what made it worse. Because women who are heavier in weight, they can easily hide it. That's easy for them to hide it. But when you're like with her, she was like about 5 pounds underweight. It really stuck out. So this is when you will see me say, yeah, maybe you should go ahead and get that done in the pedunculated form. Pedunculated ones and and I just say this already, subserosal pedunculated one, women can have a normal period. No, you'll never, if for the pedunculated and the subserosal, and the pedunculated, you're not going to have a heavy period. You're not going to have a lot of clots. Okay. And depending upon your estrogen or hormonal level, you may have mild cramping, or moodiness. But it's nothing like when you have something like this, or you have something like this going on in your uterus. So these are the type of fibroids that don't cause you to bleed heavy, doesn't cause you to expel a lot of blood clots. It doesn't cause you to expel to experience like very heavy cramping. So it doesn't do that. But these things do distort the body. And so this is one of the things that I'm against. Now I'm going to talk about, hold on, let me see. I think I have the one in addition to the other. Which one? You guys got to start using the words of the fibroids, because I talked about 5 different, I focus on 5 different ones. I did talk about the cervical intramural, but that's not as common. You know what I'm saying? This is the, in the cervix here, it's not as common when you have an intracavitary fibroid, but it happens. It happens. Not going to deny that. Let me go over some of the symptoms of these fibroids. And I went, that's why I wanted to go over the symptoms now. Oh, you have a pedunculated one. Yeah, what do you know what size the pedunculated one is? SD. And let's see. And because of my prior myomectomy, the doctor recommended a C-section if I ever want to have children to prevent uterine rupture. Hold on. And because of a C-section for a fibroid? Hold on. And because of, are you talking about a C-section during pregnancy? Or ladies, when you're typing to me, please use all the words, because you're talking out of context. Was 5 inches 2 years ago. You haven't had one 5 inches. You haven't had a ultrasound since then? Okay. Let me hold on a second. So let me go over some of the you haven't had one since then. Pedunculated. Well, let me just say this. I can see why, because pedunculated fibroid do nothing but distort the body. It makes you look like you have a little pouch, or you can feel it. It's not, it just depends on the size of it, whether it's cause an inconvenience. So, but when women have the type of fibroid, as I said earlier, intracavitary or the submucosal fibroid, these are the fibroids that does not give you a quality of life. With heavy bleeding, with constant blood clots, extremely hard, excruciating cramps. Women end up, this is what caused women to go ahead and just get hysterectomies, unfortunately. No, a C-section to birth future children, because I have a myomectomy that might cause uterine rupture if I have children. Have you heard of that? I sure haven't heard of that. How does unless the doctor who did the myomectomy did something to your cervix, I don't understand why you have to have a C-section. But I want you ladies to know that fear is a wonderful way of controlling people. Okay, so I'm just going to put that out there. Unless your cervix is damaged, which I don't see no reason why it would be. If your uterus is able to successfully hold a baby, I don't see no reason why you can't have a natural birth. I have the submucosal one as well. I'm getting breakthrough bleeding monthly as well. Well, to be honest, you really don't know what you have, because you haven't had an ultrasound in 5 years. Right? Oh, sorry. Did I read that wrong? Sorry, you said 2 years ago. If you guys, hold on. Did your ultrasound give you the name of the fibroid, because it doesn't do it in inches, SD. It does it in centimeters or millimeters. So if your ultrasound does not give you the location of the fibroid, the name of the fibroid, and where they're located in the uterus, it's just a guessing game. A YouTuber documented her journey, had a myomectomy, and her colon got punctured. She had to get a ileostomy. She had a myomectomy and her colon got punctured. How in the hell did he puncture the colon? The colon is behind the uterus. I really don't understand. You guys, wow. The bladder is in front of the uterus and the colon is behind the uterus. So I'm trying to figure out, like, how did you bypass a huge organ to mess with the small or large intestines? So I don't know. That sounds so crazy to me. It's like for the reason why I said it sounds so crazy to me, it's like oh, you said 5 centimeters. Okay, 5. Yeah, like 5 inches. What? I don't know the testimony. Excuse me, you don't know the terminology. Sorry, I'm reading you so wrong. I'm not. You don't have to look her up. I don't care. You don't have to look her up. I'm just being honest. I don't care. I'm just saying, like, some of these stories sound so crazy. I'm not saying it didn't happen. Hold on, let me just put that out there. I believe her. It's just that sounds absolutely crazy to me. You know what I'm saying? It's like basically getting a root canal and then your tonsils are removed. How? Did that make sense? You get the root canal and your tonsils are removed. Like, what? How did you bypass all the teeth to go to the back of the throat where your tonsils are? I don't know now. I don't know. Some people, I don't know. There's a lot of stories that is missing from I'm the kind of person I ask a lot of questions, so you know what I'm saying? I could have the wrong organ's name. Yeah, you could. 'Cause that don't make no sense. Okay. So we understand some of the symptoms when you have the fibroid. You have a lot, depending upon the type of fibroid you can have menstrual bleeding, painful periods. Like I said, some women who have a pedunculated, not going to have no painful period. It's not affecting the uterus like that. You also can have, like I stated, if you have intracavitary or submucosal, not only you can have heavy periods, but you can have long periods as well because you have all that endometrium building up there. So that's causing a lot of buildup, and then you're shedding that every day. And it's continued to produce more and more and more until it just stops. And then that's when the menstrual cycle starts to decline. This is the reason why women are like anemic, but that's not the only thing. These doctors tend to focus on the iron levels, but you're just deficient in nutrients, period. Not just the iron. The iron is just important because the iron affects your energy. So you can basically, have low energy. You can you're probably experiencing some issues with that, and then all of a sudden they want to go ahead and give you a blood transfusion, which I'm totally against. I'm just saying that's such a good how should I say this, because I got to be careful what I say here on this platform, but I'm just saying it's just in my opinion, it's a good con. Because the menstrual cycle, the blood in your it's coming out of your uterus, which is the menses in the lining of the uterus, is not the same as the one flowing through your blood, the ones filtered through your liver, okay, and your heart. So it's not the same blood. But you have to replenish the nutrients that you lost in your menses. You know what I'm saying? And getting somebody else's blood. If that was the case, why does everybody always have to always get it all the time? So to me, it's just silly. It's just silly. Of course, you're gonna have pelvic pressure and pain. This is depending upon where the fibroid is located. It's also depending upon the size of the uterus. Hold on a second. I just clicked off here we go. When you say you are deficient in nutrients and not just iron, is it because we are losing so much blood that it can't carry the nutrients? No. What I mean by that, it's a very good question. What I mean by that is your menses. Okay. Let me see. I like to be visual. Hold on a second, ladies. Let me get a diagram of uterus, endometrium lining. Hold on a second. Let me show you what I'm talking. Oh, here's a good picture right here. Okay, I found something. Copy image address. Okay. All right. Let's go ahead, and when I show you what I'm talking about, then you'll understand completely. Okay, here we go. All right. This is the uterus. This is the uterine lining. This is the endometrium, the menses. And what happens is that this starts to build up as you are ovulating, right? So, and the reason why is because this is how, if you were to get pregnant and you want the embryo to turn into a fetus, to turn into a baby, this is, I hit the wrong thing. This is what's going to feed it. The menses is filled with the most nutrients. It's just like when you breastfeed, the nutrients that you build the baby up is in your breast milk. Well, those nutrients are in the menses first, in your period blood. Okay, the best way I can explain it. That is coming from the endometrium lining, the lining of the uterus. This is where your vitamin C, your vitamin B, your vitamin D, your calcium, your selenium, your iodine, your iron, all of that is in your menses, not just your iron. It's just that when you get if you're low in iron, you're low in a lot of other nutrients too, but it all depends on your diet. Okay, it also depends on if you get enough sun for vitamin D. There's going to be some nutrients that are going to be more deficient than others. And this is what I'm saying. If you're low in iron, you're low in a lot of other things too, because the heavier you're bleeding and the more your class you're having, the more you're losing nutrients in general. Is that a better way you guys can understand that? Oh, wow. I didn't realize how nutrient rich are. Yeah. Why do you think, I hate to go there, but why do you think when they talk about, if you want to keep your man, you can put some red love into his spaghetti? Now, I don't think that works. I'm not sure. I don't know. I mean, don't try to force nobody to stay with you. What's wrong with y'all ladies? You know what I'm saying? Some people need to be let go. But yeah, it's very powerful. The menstrual period of our body is very powerful. Here, let me also love you. Listen, let me educate you ladies something. Do you want to know why we outlive men? Okay? The reason why we outlive men is this. When we come on our period every month, and we're bleeding like this, we are losing a lot of nutrients, okay? Nutrients that have been taken from the body in hopes to feed the embryo so it can turn into a baby, right? Women go through, so the more nutrients you're losing, the more of your life force you're also losing as well, right? So, but here's the deal. Women go through menopause. That means that the menses, the uterus, stop producing menses, the endometrium lining. It stops shedding, and therefore you're not losing any nutrients anymore. You're not losing any of your lifeline anymore. You stop, and therefore the aging has slowed down drastically. Men in their semen is where their nutrients lie. Okay, so men semen with the sperm cells and everything inside of it, that is rich in nutrients. And that is that is high in a lot of the vitamins and the minerals, okay, the amino acids in there. And here's the deal. The semen is a very alkaline liquid that is because it's so high in nutrients. Men always like to ejaculate. Even if they don't have no woman, they still like to, ejaculate. And the more they ejaculate almost every day, where we're only having our menstrual cycle once a month. Unfortunately, some women are having their menses and they're losing their nutrients for if they're having it really heavy, for 14 days. We get that, right? Men are, depending upon their sexual habits, are ejaculating every day. And when they secrete their semen, they're losing nutrients. They're losing their life force. They don't know the powers of ejaculation versus ejaculation. There's a difference between the two. I'll talk about that some other time if anybody interested. And so they could be into their 60s and 70s and 80s if they can get it up. Okay, if they can get it up, they can still can ejaculate, and therefore that prevents them. Now men also do a lot of stupid things that cause them to die off quickly. But the reason why, if let's say for instance they don't do crazy things, they don't tell their friends watch this, and then all of a sudden they unalive themselves. They basically their nutrients in itself are just depleting them in their life force, where they don't have no menopause, they don't have no woman pause. Okay, so this is the thing that caused them to die out sooner than women. Okay, so women tend to stop losing the nutrients in their body, and they stop losing a lot of their life force as well. So there's that. Do women need a multivitamin or mineral? Yes, let's talk about doc. I cannot tell you, because if it depends on your eating regimen. I don't need any multivitamin. I definitely don't. I eat my nutrients. If you have a terrible diet, if your diet is not vitamin and mineral enriched, then you need to supplement that. And that's what you do, is you take a supplement. So the supplement is for what you have a deficiency in. But I eat my nutrients, and so I don't have a and a lot of you all should not have, depending upon how you eat and what you drink, should not have any deficiencies based upon how your diet is. So you're supposed to eat to live, not live to eat. And if you're eating the nutrients that will keep you alive, that will keep your body fed, especially if you're depleting certain type of nutrients, you won't have to take supplements. I'm not against supplements. Obviously, why would I be? But I'm just saying, eat your nutrients. Stop popping. I don't want you all to have that mentality of popping pills for your nutrients. You should eat them. You're more able to. You're better off doing it that way than to popping a pill because you're deficient. So there's that. What was I talking about too? I was going back into the symptoms that you would have. Hold that thought. Let me go back to my notes. Okay, here we go. All right. So, so you're going to have that pelvic pressure and pain. Just depends upon the size of the fibroid and where they're located. Now, I said earlier, depending upon the fibroid, if the fibroid causes the uterus to tilt forward, you're going to have frequent urination. You're going to constantly have to go pee. You can drink like 1 cup of something and you got to go to the bathroom because there's so much pressure on the bladder. If it goes backwards, then you're going to have constipation. So then it's going to lean back to the colon, and then that's when you're having problems with your bowel movements. Okay. And of course, distorting of the stomach area depending upon like what size of the pedunculated or the size of the subserosal. All right. And of course, the size of the fibroid can also cause lower back pain. It can also cause pain in general. You know what I'm saying? Even if you're not on your menstrual cycle, it can cause that because your body is out of balance depending upon how heavy and how big these fibroids are. And of course, if the intramural fibroid is close to the cervix, you're going to have painful sex. Sex is going to be very painful. Like I said, these fibroids are never, ever cancerous, but they can shrink, and there's no one size fit all. This is the reason why, I had such a high success in my heyday before I went and took a sabbatical. I'm back doing it now. I'm back helping women to get rid of their fibroids. Now I came back into business. It took a while because I was, as you all know from previous streams, I got tired of women, telling, like I'm gonna still eat hamburgers, but I'll cut down on the coffee. I'm like, you ain't gonna never shrink your fibroid underneath those conditions. Holistic medicine is not for everybody. I've never been on that podium where I'm like, oh, everybody got to do holistic health. It requires discipline. It requires strength, because the medical doctor does a wonderful job of putting fear in you. And I know, like I said, my first and I intended on being my last time being admitted into a hospital for a staph infection. I literally was always on the defense with these medical doctors, fighting them like, no, you ain't doing this, you ain't doing that, and blah, blah, blah. I still told them what to do. And they would try to sneak different type of procedures, and I kept, nope. It was like I was letting them know, yeah, you got somebody here who don't worship you. You got someone here who realize you're not my God. I don't pray to you. You don't have more power over me. I understand your limitations, but I understand what you're really good at. When you're shot, you're stabbed, burnt, holy smokes, these people are the best people to go to. They are. All right. But when it comes to other things, not so much. Okay. So there's that. And I just know that when it comes to women's health, when it comes to fibroids, I am like it's like the same thing before even going on even now. It's just turned up a little notch, and they started adding a little bit. Like I said, in the beginning of 2000, C-sections were not an issue, and I remember them trying to push it on women, and I was helping women fight it. Now it's like this. Everything has completely changed. They're now inducing labor. Okay, they're now telling you that natural birth is not an option. They're telling you that you have to get a C-section, and they're making up anything they want to get you to do it. And women are falling for it like no other. And I'm like, how? Now I kind of understand the censorship that has happened with naturopaths like myself and other herbalists, the ones that are still here. They had to shut us up, and it worked, because I can't believe we're in this stage right now where the powers that be have just so much control over the mind, and they do it with fear. They do it with fear. And let me tell you something, women are easy to scare, honey. They're easy to scare. All right, and so that's how, let me just go over this. So if you have any questions, go ahead and ask. But that's what I wanted to just educate you all on the different fibroids. We got the intracavitary, we have the submucosal, we have the intramural, we have the subserosal, and we have the pedunculated. And then I went over on the menses, saying how that all works out, why you have heavy menstrual cycles depending upon where they're located, and why is so much nutrients in this, and this is the reason why you're low in iron. But if you were to get a complete nutritional analysis, you will see that you're deficient in a lot of things, not just iron. It's obvious to tell that you're in iron because of your energy level being low. I know a couple who voluntarily scheduled a C-section delivery. Yeah, we always got slaves. They always submit to masters. I guess because C-sections are so much more profitable. Absolutely. Absolutely. Because it's a surgery. It's a legit surgery. And once they give you a C-section, they will put it in the file that you will never get no natural birth. You know what I'm saying? They fix it to the where once you get all they got to do is get you to get that one C-section. Get that one C-section. They got you from then on out. There's no more vaginal births after that. They're like, oh, well, once you got a C-section, we got to perform the other births based on C-section. They'll give you some kind of excuse, but, they'll put it in your medical records that, yeah, you had a C-section. So now, and by the way, medical doctors are going to automatically know you have a C-section because they can tell from the condition of the vaginal canal versus the scars for the C-section. What treatment would you recommend for intramural, subserosal, submucosal? And I don't recommend any treatments. I'm not a medical doctor. So this is the thing that I want you guys to understand, is this is how they can automatically tell you that you had a C-section. So they don't really necessarily have to go and they don't necessarily have to ask if you had one or not. They can automatically see one. It is true. My friend was told that she can only get C-sections because she had one first. Yeah, it's a setup. Once they get you with that first one, they got you, baby. They got you. So, what can you do? Like I said, when I had I had a couple of women who had hired me because they, I was, hoping they would do the home birth, but one of them had changed their mind. Anyway, I was there and the doctor was like, oh, the baby can't breathe. I think I told this story so many times. It was the most stupid thing ever. And there's that. Not always you can have a vaginal after C-section. You can have a vaginal birth on any condition. Medical doctors will not. I need you all to listen to my language. Get out your emotions. Listen to my language. You can do a lot of things. You can have your baby at your house, but you won't. When you go to the medical doctor and they notice that you already have a C-section, they are not going to go the vaginal route. These are facts. These are 100% facts. Now, we all know you can have a vaginal birth. That's irrelevant. What is relevant and what is on topic is that once the medical doctor gets you to have one C-section, they are focusing on all of your C-sections. You ladies ain't got the backbone to walk up in there and say, I don't care if I had a C-section, I'm going to have a vaginal birth. Stop playing games with me. Y'all don't even have it like that. Because if that was the case, you wouldn't have got the C-section in the first place. You ain't going to find no expert. I'm sorry, Goldie. What doctor you going to find that's going to do that? And that's what I'm saying. Y'all just, girl, please don't play with me up in here. Y'all acting like these medical doctors are not looking out for their best interest financially. You ain't gonna find one. I promise you. That's the reason why you're vaguely saying, find an experienced doctor. You ain't gonna find one. They all on one code. Can you explain why low estrogen birth control is not a good option to alleviate heavy menses until one can get their fibroids shrunken? Ty, if you have too much estrogen, why would you take more estrogen? If your menstrual cycle is heavy because you have too much estrogen, why take more estrogen? I would. I was born in a house. I'm different. That's right, Lovey. But I'm just saying, there are some of us who come from that world, though, Lovey. We come from the world where we don't worship these crazy medical. These women, they look at the white coats and go, I worship you. I worship you. You're my God. Whatever you say. They are so submissive. You would swear they would get knee pads and immediately get on their knees and start praying to these clowns. You know what I'm saying? And I never, and also, let me also be clear. I wasn't raised to worship no daggone medical doctor. I wasn't raised to think that that these white coats had all the answers and that they were the saviors. Okay, I wasn't raised that way, and maybe that's the reason why I have this mentality, and I've always have this mentality. Okay, I would if I catered to the medical doctor, I wouldn't have a uterus now. Remember, you all, I don't talk about it now because it's such old news, but let's not forget how I got into this field in the first place. I had cervical cancer. Medical doctor told me, we're going to have to give you a hysterectomy. I said, not going to do that. I want to keep my uterus just in case I want to have a baby. And then they would say, well, we're going to give you chemotherapy. No, I see how chemotherapy has killed has destroyed my aunt. Okay. Then he was like, well, then you're just going to die. I said, you're not my God. I don't pray to you. You didn't create me. So therefore you can't take me out. You need to rebuke these people. And I'm not talking on a Christian level either. I'm not going to sit up here and let you bestow that evilness on me. You don't tell me what I'm going to do. You did not make me. I don't pray to you. You have no divine power over me. That's why some of y'all need to go to your God over there in the medical system. And the rest of us, we going to be doing our thing over here in holistic health. Because some of you guys want to combine medical with holistic. That is not, y'all on the wrong channel for that one. I'm going to let y'all know right now. You on the wrong channel. I will never sign up for that where you're like, oh, I'm going to take this medication, but I'm also going to take these herbs. Child, please. Choose a God. Choose a God. So, no. If you, and you're not hurting my feelings, I just want you to understand, if it's a matter of life and death, okay, yeah, do the medical doctor thing, okay? I get it. You're not going to, I don't have no problem with that. But you all, not you, but I'm just saying, let me stop saying you all then. Some people rather die than change their diet. Some people rather be on medication than drink water. Like the basic things that's going to keep you alive, the basic things that's going to keep you living a quality of life, then that's going to have you sick. That's my thing. And so if that's you, you're on the wrong channel, because I'm not going to cater to that. I'm not going to cater to this. What are you going to do for this? Stop asking me about medical doctors. I'm not a medical doctor. Okay. Don't even try to pretend to be one. I don't give medical advice. And if you want something dealing with the medical institution, then go over there to a medical doctor and deal with him. I deal with holistic medicine. I thought you got the memo when you signed up for this channel, but apparently not. Rebuke the divorce for your sake. Yeah, exactly. Some people, listen, I'm going to say this. If nobody got any more questions, I'm going to end the stream because I don't want this to go too far. I am very careful what I allow into my subconscious mind. Okay. And I've learned this as I gotten older, when my mom, when I went through a psychological counseling, and I was taught this through this person, and it changed the way I think about things from then on out. My mom, used to say, oh, you so stupid. You're doing this. You're so stupid. Just constantly used to tell me this as a little girl, to the point where I believed her. Okay. Used to say, and this is why you got to be very careful what you tell not only your friends and your family, but you got to be careful what you tell other children. You tell them they're stupid in their conscious mind, they subconsciously are going to believe they are. And then in reality, they will do stupid things. They will act stupid. Okay. They'll do that. Right. as I gotten older, right, and I had to unlearn those things, I had to remove those things from my subconscious mind. I never will, and basically heal my inner child. I never tell myself negative things at all, not even joking. You know, there's a new joke people say. You will never hear me say this. Some people, when they get a real good, they get, what do they say? They hear a really good joke, and then they tell themselves they did. You know what I'm saying? Do you guys understand what I'm talking about? They'll hear a joke and they'll use on the chat room, and something was so funny that they said something to the point where they laughed to the point where they were dead. I would never joke like this. Words have power. Words have power. Okay. I would not even in a joking manner will I say something so condemning against myself like that. I don't do that. I know the power of words. Okay. And so this is the reason why I don't play these games that these other industry people will play when they want to tell you what you can and cannot do. I was never like that. Even when the doctor told me about the cancer, you know what I'm saying? I was like, the cervical cancer I had. And we're talking about, this is way back. I'm not even going to tell you how long time ago. So yeah, I learned back then to never let anyone implant anything into your mind that is against not that against you, but against your livelihood, against your health and happiness. Rebuke it. You can always rebuke it. You can always say that ain't true. And sometimes we get these silly men telling other women, oh, you're going to die alone. That's just projection. And you need to tell them, oh, you're just projecting, because based upon statistics, men are mostly known to die. And by the way, this is an actual peer-reviewed study. What I'm about to tell you is actually factual. Men are mostly found alone dead, not women. So, when some stranger or some idiot or some family member going to tell you what you are, just like you're just projecting. That is not going to happen to me. That's going to happen to you. Just remove it. Okay. So there's that. Hold on, girl, get out of my daggone. Bye. So there's that. I don't know. First of all, Goldie, let me tell you something, girl. I'm the HBIC up in this daggone place, okay? If you don't like it, unsub, heifer. Unsub. I don't even know who you are anyway. This is my first time seeing you in any of my daggone live streams, and you come up in here and disrespect me. Take a timeout. You go on a 24-hour timeout. I catch you up in here again. That means I'm giving you a chance. Cause maybe you on crack, you smoke some meth. I don't know what's going on with you today, but you're gonna realize you picked the wrong one, honey. You picked the wrong one. I'm not one of these hippie type of naturopaths. Okay, I'm a hood naturopath. I'm a hood naturopath, girl. Okay, I will check you quick. Anyway. So you come up in my next, so you're in 24-hour timeout. You come up into my daggone chat again, and I will perma-ban you. Now go drink some water, take a bath, go walk it off. I don't know what's going on with you, but go do what you got to do, honey. You're not necessarily needed here, but if you got a problem with me, trust me, I will solve it. Yeah, these women gonna learn. I've never seen this heifer in my daggone chat ever. And she coming up in here with some attitude. I've never seen her, ever. So, yeah. Hood healer. Oh, I like that. I like that, coolest redhead. Yes, I'm a hood healer. What's that, Quintara? That's right, I'm a hood healer. I don't play that. Shoot, girl. Sure, I got too many accolades and daggone success stories for you to come up in here and try to tell me what to do with my daggone chat. You got break an attitude. That don't work with me. Ain't gonna learn. Doctor, you should put that on a t-shirt. I should, shouldn't I? Hood healer. And let me just say this. I understand that a lot of naturopaths are nice. They're nice and calm and loving. You know what I'm saying? You know what I'm saying? Peace and power to Queen Afua. She's very nice, very kind, loving. Oh, please, she's like, she got that grandma energy. That ain't me, honey. That ain't me. I got mean auntie energy. I'll cuss you out real quick, and then I'll like get over it and may give you some food next time, but don't play that. I mean, you're nice enough to share this with us. I guess that's the subjective thing. Yeah, I want to I want to come back to teaching again, and I just let my channel die. Excuse me. I let my channel die, and I'm coming back consistently. Thank you, your pa. I'm coming back consistently, and so people don't remember me. People don't know much about me. Excuse me, let me drink some water. People forget. Or to be honest, they just don't know me. You know what I'm saying? One thing people do know about me is that they can never say, oh, Dr. Keela, man, she is so soft and cuddly, and she's so zen. That ain't me at all. You gotta have a thick skin. You gotta have a thick skin if you deal with me. But I promise you, you know what I'm saying, I'll help you, because that's what I want to do. And I have a gift, and I would use those gifts to help get you to where you need to be. So there's that. All right, there, beloved. That's the conclusion of today's show. So I was praying for your resurrection. I have arised. Okay, I have risen. I have risen. I'm trying to catch up. Please be here to stay. Oh, I'm here to stay. I'm here to stay now. I have to admit, I'm learning, and some are confirming, Doc. I had a myomectomy in 2016 and changed my eating habits. Cool. Good. Continue on that path. Listen, I'm here to stay. I've been doing this, 2 months now? So I am keeping it up. Now, my goal is to do 2 streams a week, but even if I don't do 2 streams a week, I will give you 1 stream a week. So there's that. All right, beloved. So I will be back next. I'm gonna go again and try to do something next Tuesday. But if I don't, then be prepared for me to do these on Saturdays from now on. But if I don't do a live stream, I will definitely give you a video. So let's see how that is. Okay, beloved, you all have a wonderful day. Thank you so much for coming by. And I will see you on the next one, okay? Have a good season's greetings. Christmas for those of you who practice it. Hanukkah, anyway, all of the holidays. I'm not going to be and name all the holidays. Have a good one, and I'll see you on the next one, okay? Peace and blessings.